And welcome once again to Living in the 21st Century. We are here today with John Kelly. He's the director for Second Thoughts, and also Anita Cameron, director for Minority Outreach, Not Dead Yet. I want to welcome you both to Living in the 21st Century. And we are dealing with some very turbulent times with COVID-19. And I know this may be some chaos for those who are in the disability way of living. John, I want to first ask you, at this juncture in time, how are you faring and how are you keeping up with COVID-19 in terms of getting help, in terms of have workers there for you? How's that going?
Well, thank you, Errol. Things are difficult for disabled people right now, both in terms of severely disabled people, finding people who can help us. I just had my third helper with suspicion of COVID, but it turned out he just had a cold. Right now, a lot of people are saying, oh, there's nothing to worry about. It's just people with comorbidities and elderly people. Well, when we talk about comorbidities, we're talking about disabled people and people with chronic illness, and it makes us very vulnerable. And we do not feel reassured when people say, oh, no one has to worry. It's just those people. And the way that disabled people continue to be discounted and just thrown under the bus.
Okay. Anita, I want to ask you this question because it is clearly stated and noted that more minority are at a higher level of contracting COVID and they're dying. All this is happening. What, from your observation, and what advice would you want to give out there to minorities when it comes to COVID-19?
Well, we protect ourselves. I mean, a big part of why COVID has ravaged our community, has to do with the disparities in healthcare to cause us to get inferior healthcare and to get inferior treatments like diabetes and cardiac conditions that could make getting COVID, any of the variants, to make it getting worse. So, we have to be careful, but that doesn't mean that we're disposable, as our CDC seems to think that it's encouraging that it's, just the sick people, getting it, that healthy people aren't getting it. But that's just, it's throwing us under the bus, and it's contributing to the disparities in healthcare, whether it's racial disparities, and disability discrimination. And, when you intersect that, then that makes it worse. So certainly the racial disparities and disability disparities that we experience contributed to this.
Yes.
I would just follow up on that, Errol, to say that when COVID first hit, many state governments immediately convened doctors and came up with what they called crisis standards of care. And these were protocols in which they would determine who deserved to live and who deserved to die. So like in Massachusetts, they were looking at 5-year survival rates and things like that. And these are based on the estimates of prejudiced doctors.
Yes.
And so it was a coalition of disability activists and civil rights activists working together because, as Anita can tell you, Black people, Indigenous people, people of color experience more disabling conditions because of systemic racism and poverty.
I'm glad you touched on that part, because one of the things I want to ask, we know for a fact that in the medical field or the healthcare field, we expect doctors and nurses to have more on the compassionate side, to be more sensitive to patients and so forth. Since COVID has stepped in, and it's hardly approaching 3 years now, we found that, do you see any ways that you can now tell the true doctors and nurses? Because it appears that a lot of nurses and doctors jump ship since this disease came in and no longer have an interest in taking care with patients directly. And I think now the healthcare field is starved for nurses and in some cases doctors. How do you see the outcome of this now with people with disability? Because it don't seems to me that that things are stacking their favor. It's just something just in matching up right now. What do you think about that?
Well, I think the first thing we have to remember is that there's always a context to what is going on. And so these nurses and doctors and medical personnel who are burning out, it's understandable because over the past 20 years, this neoliberal approach to hospital beds, thousands and thousands of hospital beds have been shut down. Smaller hospitals have been shut down. And so we don't have the surplus facilities to care for people. And there weren't enough workers because the hospital administrations are always trying to limit the number of skilled personnel on a floor to cut costs. And so, you know, we have the problem of doctors and nurses leaving, but we always have the problem of medical prejudice against us. A study released last spring showed that 82% of doctors have bias against disabled people and think that our quality of life is worse than other people. And some people listening to this might think, oh my gosh, well, that's obvious, but it's not true. We're here to say that we love our lives are full, and the only things that are getting in the way of our having an even better life is the oppression that we experience.
You know, it's strange that I think Dr. Fauci said yesterday or the day before, one of those days, that COVID-19, this Omicron virus would kill some will live and some will die. But the reality is we can say the same very thing for the beginning of COVID. Some lived, some died. But does this sound like a relaxation mode where they throw back their hands and give up? Because we already know that some will live and some will die. I heard even before that they were calling into question the psychology of testing, as to say, well, you know what, the testing is not so important. Well then, if that's the case, how will you know that someone who is working for you or a family member, if not tested, they can bring that virus and just give it to you? Is the medical hierarchical group that overseeing this, like CDC and so forth, want to tone things down and bring things to a relaxation stage simply because of political interference, this time in a silent matter, because before, and this is not choosing sides of Republican or Democrats, when it was the Republicans, everything was all the way out there. Everyone was speaking vocally about it, and everything was up there in your face. But now things seems to be on a more silent wave. I think this is dangerous, not just to disabled people, but to the world as a whole. Kids are dying. They are getting more even serious than before. And the reality, they are the ones who are bringing it now and giving it to the elderly people, their family members, and those who come into contact with them. I don't know, John. I mean, is there advice? Is there a word you would like to say to call in or to question the integrity of CDC or those who are in an authoritative medical practice, that they can be sincere to the public at large?
Well, the problem with the CDC is it's become clear that they make decisions not just based on medical science, but based on political considerations. Mm-hmm. So when the big airlines complained about the 10-day quarantine for people who had been exposed, the CDC immediately reduced that to 5 days. But now the reality is complicated because Omicron, the COVID-19 variant that's now dominant, is incredibly contagious. Mm-hmm. And so we are seeing just thousands and thousands of new cases, but we mustn't therefore just throw up our hands and give up all testing. People who are most vulnerable continue to need protection, and we need to be able to test in order to protect ourselves, and so that we can avoid going to the hospitals. And how do you think this will affect minorities, Anita?
Well, I mean, it's going to make an already bad situation worse. And a lot of us are going to be sitting in those emergency rooms, not realizing, or, so sick that we can't be at home, but we won't be able to get a bed in a hospital. We'll be filling up emergency rooms and things of that nature, because a lot of us didn't have, the access to the good medical care that could, help us through this. So we're still seeing, disproportionate numbers of people in communities of color getting this and dying, from this. And it's just going to get worse. And as states, enter their crisis of care standards, that's going to disproportionately affect us and affect poor people, as well as communities of color. So poor people, everywhere. And so it's, it's going to have, it's already having the results, but when the CDC says things like it says, and even as it tries to wipe it clean, what they said, it already kind of puts buds in people's minds that really shouldn't be. So, yeah.
So, Anita, I want to ask you this question. Do you think the healthcare system or the political system or even the economic system of this country would ever be in favor for minorities? Or would minorities ever get true representation from their state representatives in their states? What is your opinion on that?
I would say, wow, it's better than, say, years ago. I think as long as we have systemic and structural racism embedded into the system, as communities of color, there will be no equality, at all. And I'd say the same thing for disability discrimination. That's a systemic thing, and part and parcel, of it's certainly a factor in white supremacy and eugenics and all. And unless we root out that in this society, whether American society or society at large, this is what we're gonna get.
Why do you think that Black people or minorities are overlooked when it comes to major disasters or issues like this? You have an idea?
Racism. Which again is tied up into white supremacy. If you're poor, you mix in, who cares about, poverty? You factor in, disability, and on and on, and on. And so because society does not, typically, you have some people that, they pity us, but do they really care? When budget crises comes, what are the first programs cut? Programs that affect our lives, the lives of people with disabilities, and then you factor in, race, color, class, and I don't see this. I don't see this changing any. We're becoming aware, and so Blacks, indigenous folks, we're learning. Well, the studies are showing what we've already known about how we're treated for pain, about how, our treatment tends to be not as good as, other groups, medical treatment and all. These stories are coming out, and it's validating what we've known, all along. And so, I don't see this ending, unfortunately.
John, do you think that people in the disability brackets and minorities are placed in one category and deemed as not to be honored or respected as living, breathing human beings, and are treated at the lowest of life without any really respect is just a makeshift something. They are overlooked. This has been going on for like centuries. What is your opinion about that?
Well, that's definitely been going on. I mean, just following up on what Anita said about, the racism problem, when CNN wants to talk about poor people, they go to inner city Black neighborhoods.
Yes.
And they don't go out to the rural areas and find all the poor white people, such that many white people don't know that there are more poor white people in this country than there are poor Black people, for example, and that any program for poor people is going to affect more white people than Black people, but in kind of the standard American white person's mind, poor equals Black and poor equals undeserving. And whereas with disabled people, we're just not seen as fully human. Right. And, they've discovered that, 90% of Americans have absolutely no impact on what our government does. And that 10% of people that do is predominantly white, professional class, non-disabled people. So really basic, what we need is for everyone to be seen as a full human being, unique in ourselves, and worthy of protection. But, what we've seen with COVID-19 is that what's always been happening with disabled people and people of color is that we've been treated worse. So, yes. For example, there was the case of Sarah McSweeney, a developmentally disabled white woman in Oregon who had she loved life. She was like 45 years old. She didn't speak or walk, but she was vivacious and animated and loved to have a good time. And the hospital that she was taken to with some pneumonia basically refused to treat her because they felt like her quality of life was too low. And she ended up dying because they just refused to credit her own desires. And then, Anita, maybe you could talk about Michael Hickson.
Yeah, that happened to Michael Hickson. Michael Hickson, he was from Texas, living in Texas, 46-year-old Black man. And he got paraplegia as a result of no oxygen to his brain during a heart attack. He, had his wife and his 5 children. He was placed in a nursing home where he caught COVID. And the doctors refused, and the wife has it on tape, refused to treat him for his COVID, specifically because of his disability, saying that because he couldn't walk, that he had no quality of life. And so he was placed in hospice and allowed to die. And so, that's in his case, thank goodness the wife, had the tapes, of exactly what the doctor said to her regarding, regarding Michael, because nothing that he wanted, was done or that his family wanted. was done. So, yeah.
Okay. And John, we got like little under 2 minutes now. I want to ask this question. Do you believe it's time that those of disabilities get together and probably try to build an alliance where they can look at whether it's raising funds and hiring an emergency team in case they need help, that there's someone they can reach out to rather than waiting to get the full support of the system? I don't know. I just decided to throw that question out at you.
Well, we're fighting for our lives right now in so many ways that, everyone is doing the best we can in terms of having support services. But, with the problems of isolation and the contagiousness of this Omicron variant, it has been very difficult. And, states are always looking to cut costs at our peril. And so, it's very challenging right now. What we need are people who are used to being in control of their lives and, think that everything's fine for them, is to understand that for most people in this country, we're at the mercy of